This conference will now be recorded.
At this time, I'm going to ask Ann Smith to go over some of the Gotomeeting rules so that we're all on the same page and understand what we need to do in order for this to be effectively transcribed as required by the state. So go ahead, Ann.
So thank you, and it's great to see all of you that have your camera on. I do ask that if you could possibly have your camera on, that is a benefit for us as we are moving through the meeting. Again, when you log in, utilizing your first and last name helps with the transcription. And most everybody did that. If you're not able to edit what you have there, we'll edit it and ensure your last name is included. So we do not want to have to automatically mute everybody. So we ask that you please mute yourself when you are not speaking to decrease any background noises. Again, keep your camera on if possible. If you want to speak, please feel free to type a S in the chat box that is up in the right-hand corner of your screen. There's a little bubble. You can send your message to the organizer. We will be monitoring that chat and we will let the chair know so they can call on you to speak. Please do not let this platform hinder any productive conversation that we need to have regarding EMS within the region. We will be doing the CON motion towards the beginning of the meeting, but all other motions will be combined and done at the end of the meeting. So for example, the approval of the minutes, we will have to do a roll call vote for each motion so that we have it duly recorded. Hence the reason why we are going to do them all together towards the end. You have myself, Jonathan, and I do believe, and thank you to Tom Zecker from FDR-HPO who just joined us, trying to help us troubleshoot any technical issues that we have. So again, if you have any comments, please feel free to put them into the chat box, or if you wish to speak, just put an S. From there, Debbie, I think unless anybody has any questions, that's pretty much the gist of it.
Thank you, Ann. I would like to start with the Pledge of Allegiance, and then we're going to go into the Turin transfer. So, Paul, if you would lead us in a pledge, please. And we're just going to ask Paul to, actually, Ann, I think we only want Paul to say it because you said that messed up last time, correct?
Correct. When everybody tries to speak, so if everybody could just stand and hopefully if they have a flag nearby and move forward, Paul.
Paul, you have to unmute. Paul, you have to unmute. Can Paul not hear us?
I don't think he can.
The Gotomeeting is actually showing, well, he was unmuted. Now he's unmuted.
Paul, can you hear us? Okay, I will lead us in the pledge because we need to have it recorded. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, at this time, we're going to go into the Turin ambulance transfer of operating territory. Jonathan, if you could bring up the information, please.
Should be on your screen.
So on 6/19, we received a CON paperwork for transfer of operating authority from Turin Volunteer Fire Company, Inc. to Turin Ambulance, Inc. We deemed it complete on 6/30. It was at that time posted on the website for council review. We have had 2 or 3 calls on this with the state. Dana Jonas, Dan Clayton, Mike Bogozzi, Ann Smith, and myself. And then on Friday, we had another call with Paul Dickinson, who has been installed as the president of the new service. It is a not-for-profit going to be called Turin Ambulance, Inc. They already have the federal ID number. They have all that stuff done. We received back today the F&C saying that it was deemed complete. We had some additional addendums that were posted to the website as a result of some information that the state had wanted to see. We were following the application, and it's kind of, on the first page of the application, it says if it's a transferring, that you don't need to do certain sections. And then on the second page, it says attached will be the financial information. So the form for kind of doesn't line up. There was some concerns from the state. There wasn't anything in there talking about how the transfer of the assets were going to go, and that has all been supplied to the state. Paul, do you have any information you would like to share with the council about what you're doing?
At this time, we're going to be holding a board meeting with the new directors, just finalizing all the stuff we spoke with the state on Friday. That should be all completed by midweek and submitted back to the state. That's about it.
So the CON committee brings forth a seconded motion to approve the transfer of service operating authority from Turin Volunteer Fire Company Incorporated to Turin Ambulance Incorporated. Does anybody have any questions? Does anybody have any questions? Barring hearing any questions, Dave Sherman, Secretary for the North Country REMSCo, could you please do a roll call vote on this seconded motion, please?
Debbie,
Yeah.
prior to the roll call, we do have one question that came across in the chat. Mark has asked, Mark Dalton has asked if the operational geographic territory has been clarified.
At this time, the state is allowing us to go with what they had and with the map that they had, and we're going to be working with them to spell out the exact area with road names and things like that, like what we had to do with another service. But that is not a requirement for this because it's just a transfer, but we're going to work with them and help them get that done to meet that requirement.
Right. Debbie, Mark has asked to speak.
Will this geographical territory question hold the Turin Ambulance Corporation up with this transfer?
No. Any other questions? Any other questions? Dave Sherman, roll call vote, please.
Can you hear me all right? Can you hear me?
Yes.
Okay. James Barr?
Yes.
Paul Barter?
Yes.
Mike Bennett?
Yes.
Karen, Karen Blackburn?
Yes.
Mark Dalton?
Yes.
Mark Devers?
Yes.
Ken Gardner? Ken Gardner? Art Garno?
Yes.
Larry Gerard?
Yes.
Jay Gwinnett?
Oh, I didn't get that name.
Jay Gwinnett? Ron Hantz?
Yes.
Rich Hughes?
Yes.
Alicia Jancy?
Yes.
Kristen Johnson?
Yes.
Walt Lehman? Josh Levesque?
Yes.
Bob McKenzie?
Yes.
John Mitchell?
Yes.
Carol Munch?
Yes.
Lance Ronas?
Yes.
David Sherman, yes. Bobby Simpson? Debbie Singleton?
Yes.
Ron Smith?
Yes.
Dottie Suter? Mark Tuttle?
Yes.
Bruce Wright? Matt Yelton?
Yes.
Motion passes 22 in the affirmative, no votes against.
Thank you very much, Dave. Paul, is there anything you would like to add?
No, I appreciate your guys' time and thought into this, and I'll be contact the few I need to in the future.
Very good. You know how to get a hold of us. We'll do what we can to support you and make sure that your endeavor is successful for you. There's a lot of knowledge in this council, and you need to take advantage of it. We'll do what we can to help you. Okay, barring nothing else, Savetta, that is all we needed you for, was for that. You can go ahead and sign off, and we'll continue on with our meeting.
Okay, that, Jonathan, that form that you posted for everybody to see with regards to this, if you can email that in addition to the attendance sheet, that would be great.
You got it.
Thank you. Have a good day, everyone.
Thank you, Savetta.
too.
You're welcome.
Dave,
Thank you.
Dave, can you go in and change your name from owner and put your name there, please, since this is recorded?
I am sorry. I'll try to. I just
That's
switched
okay.
over to my computer. My phone was dying.
No, and Bobby, could you add your last name to yours, please?
To my what, where?
It shows you just signed on as Bobby. We need you to add Simpson in there, please.
Well, I didn't do it, so I don't know.
And then we have somebody shown as caller 05. We don't know who that is.
I think that's me as well,
Okay,
because I lost you and had to come back in.
okay,
Sorry about that.
that's okay. We'll proceed on with the meeting at this point. Review of the previous minutes and approval, minutes from the February 3rd meeting. Any changes, additions, subtractions? Hearing none, do I have a motion to accept it? And whoever says that needs to say their name, please, and whoever seconds it needs to do the same so that the transcription will pick it up, please.
I'll make a motion to accept.
Okay, whoever just said that, we need them to say their name, please, so we know who it is for the record.
Mark Dalton.
Mark Bell, second.
So we have a
Can you have a
motion from
second,
Mark
please?
Dalton and a second from Carol Mooch to accept the minutes as were forwarded to you. We will come back and do the roll call votes at the end. We'll just get the motions and the seconds out of the way. Jay Gannett, are you on? Somebody's not muted and it's giving us a lot of feedback. Jonathan, did we send out the treasurer's report?
I had sent it with the reconciliation to you and Jay. Give me 2 seconds and I can dig it out of my email. I can at least give an overall view of what you've got in your savings and checking account.
Thank you very much. We will go on to the enforcement list. One dated June 23rd, revoked effective 6/16 of 20 for violations of 10 NYCRR Part 800.16, 2, 3, 8, and 10, a Jamie Whiting from Rochester, New York. One dated June 17th, revoked effective 3/6/20, assessed a civil penalty of $500 for violations of 10 NYCRR Part 800.16A4, a David Torres from Brooklyn, New York. And one dated June 17th, suspended for 1 year effective 3/24/20, assessed a civil penalty of $2,000 for violations of 10 NYCRR 800.15A, 800.16A1, 800.15B, and 800.16A4, a Roberto Valcanez from Bronx, New York. And those are the enforcements that I have. And any other correspondence?
No, not outside of what'll be in my report.
I have your treasurer's report now.
Go ahead, please.
Checking, you've got $11,492.53. And savings is $16,687.07 for a combined total of $28,179.60.
Any questions on the treasurer's report? Very good. We will approve that at the end as well. Committee reports. Mark Tuttle, Air Medical, please.
Good evening. From an air medical perspective, you should have received the Q2 clearinghouse report, just the summation of that in big numbers. There was 86 flights completed in the Q2. If you have any specific questions on the report, you can direct them to myself or Colleen. Colleen's also on the call, so if you have any specific questions, feel free to ask. I don't think there's really anything else to add other than just note of information. Air Methods, LifeNet of New York has been at Fort Drum for the last year. That contract ends the end of this month as the military is back. The 310 medevac, they're essentially back now training up, and they will resume their regular operations effective August 1st. And other than that, I don't know if Matt Yelton or Colleen have anything to add, but that's all I have.
Nothing else, pretty much status quo. You guys get the monthly reports from us via email, but likewise, if there's any questions, just shoot me an email or a text message.
Colleen Gleason, anything to add?
Good morning. Good evening. Sorry. Good morning. It is Colleen Gleason, and I have nothing else to add. Thank you.
Okay. Auditing. The monthly reports are being done by the FDR-HPO, Jonathan, as we do contract with the program agency to enter all the checks into the system and do the reconciliations every month. That is something that we are going to budget to continue to have done there. Bobby, anything under bylaw? Bobby Simpson, anything under bylaw?
I think we might have lost her.
CON, if you noticed at the bottom of the agenda, it said next meeting date to be determined. There is a possibility that there may be another CON coming through. So that's why we left it like that. If there is not, our next meeting would be October 19th. So we'll hold off and see if there's anything under the CON. Executive, we have met a couple times. The state has changed the budget information now. It now has to be put into the grants gateway. All the information required is in there. I'm working with a person down there. I have authorization to view but not save it, and they're trying to fix that so that I can enter the new budget and get that in there. So hopefully we can get that resolved and get that new budget in there. Dave Sherman, legislation.
Sorry, I had to get unmuted. We did not have a meeting, but we've been paying attention to what's been going on here. As we're all aware, things have been getting cut because of COVID. There's a lot of discussion about the massive debt that's increasing. There's great concern that our Medicaid will be attached. The talk right now is that they're not touching it. We're hoping that that will continue. We're putting together some. There's agencies that are putting together some meetings with people in Albany to maintain what we've been getting. Before COVID, there was a push. We were going to go in and try to really fight for more Medicaid money. With there not being any to give right now. That's been kind of put on hold with the push to hopefully maintain the crossovers and the supplements. Other than that, there's not been a lot of legislation going on specific to EMS, but we'll keep you. We'll continue to monitor that.
Thank you very much. Carol, anything under membership?
I have nothing under membership at this time.
I don't believe Dottie Suter is on. Bobby Simpson, have you returned for nominating committee? Okay, I know that they sent out for the 2 positions, no change in officers. Mark Devers to continue with vice chair, Jay Gannett to continue with treasurer. Again, we'll do these voting at the end and see if there's any other nominations from the floor. Mark Devers, peer, please.
Good evening. I'm trying to get Jonathan a link. So before COVID, we had been working with the folks from NAHAC and their resources and Karen Blackburn to work on some media. We did get a video done that I'm trying to get to Jonathan to put on the screen right now, but I'm having some internet problems. We were planning on working on some other pamphlets or handouts of the like to promote EMS and the need for EMS and the importance in the community. I think Jonathan got the video, so it's only about 30 seconds long. So if it's okay with you, I'd like to let him play it real quick.
Absolutely.
Was everyone able to hear that?
Yes.
Yes.
Just the music at the end.
I didn't hear anything.
Yeah, there's no talking in that video. It's just music.
So that is on NYSEMPA's webpage, nysempa.org is where that video is available at. And that was produced by Health Workforce of New York and their resources, and we very much appreciate their generosity and time. We will be, hopefully, when this COVID stuff is over with, continue to work with them to do some similar projects. EMS Awards, we are working on finalizing the awards to forward on to the state. One thing that we've discussed in the executive committee has met a couple of times over the last week or two to discuss it, is when you're writing awards, if you go to the state's website, it lists requirements for the award, and it's really above and beyond the call of duty. It's not doing a call and doing a really good call as much as doing something throughout the year that promotes or improves EMS. And that is the end of my report.
Thank you very much. Ian, if you would do program agency and Remac together, I'd appreciate it.
Thank you. So the first thing I'll start off before I forget is to just let you know that Jonathan is physically back in the office on Thursdays and Fridays, and he is working from home Mondays through Wednesdays. I still remain working remotely, but am available. My office phone is here, and you can still contact me via the office phone or via email, and the same goes for Jonathan. So a couple of items of correspondence that we had at the Remac meeting was the announcement that Bassett Medical Center has been verified as an adult level 3 trauma center. That was back in they were verified in January. I received it mid-February, but we have not met since then. We did receive a BLSFR agency code update. So Smithville Fire Department had successfully updated their BLSFR agency code. And we received EMS feedback from Upstate Stroke Center. And we'd like to do a shout out to Governor Rescue and LifeNet of New York for their treatment of a 77-year-old female found down by her husband. The long and short of it is they recognized her stroke and got her to Upstate quickly, and the outcome was discharged to home with minor facial paralysis. So great job to everybody. We've also received just recently 3 certificate of need renewals, one for Carthage ambulance, one for Natural Bridge, and today we received Parishville's. And I received a state administrative procedures letter extending Norfolk Rescue's CON because they expired right in the midst of the whole COVID thing. I haven't seen their actual CON yet. I will be following up with them to see if they had received that. So go ahead, Jonathan, with the report. Okay, so I virtually attended the Regional Stroke Advisory Committee as well as the Regional Trauma Advisory Committee. At the Trauma Advisory Committee, they did a couple great presentations, one surrounding a medication that they were using with ambulatory surgical patients that, you know, showed some good outcomes with decreased side effects with elderly patients, as well as a presentation from the Upstate Pediatric Trauma Chair. So, and the main take-home point there was if the hospital's not going to be able to do anything for that patient, they don't need to get an image if it's not needed for stabilization, if they don't have the resources to treat them locally. At the Regional Stroke Advisory Committee, they are decreasing, or oh my goodness, excuse me, they are reporting that there is a decrease in the volume of stroke patients that's impacting data. some of the processes surrounding protection for everybody, and COVID had reported some increased time. But again, it's hard to tell whether it's the decrease in volume that's impacting that. They are looking at doing some virtual stroke education, and we were working prior to COVID on the FAST ED education with our providers to help them identify large vessel occlusions and get them to a comprehensive stroke center. So I have resent that memo. I only had like 3 agencies that reported back that all their members had completed that online education. So we're back to tracking that and encouraging our folks to finish that. So next one, Jonathan. So the Remac approved a medical director change for Fort Drum Ambulance to Dr. Isaac Mills. We also put a reminder out to all the medical directors that they have to ensure that they are reviewing any medication administrations with the listed meds on the screen. As well, the agency should have a process to facilitate that review with the medical director and documentation that has been completed along with any findings. And for the transcript, I'll just read those medications off. That's Versed, morphine, fentanyl, and ketamine. Thanks, Jonathan. You can go on. Approved level of care changes, Parrishville Fire Department, upgraded from critical care to paramedic, and Tri-Town Rescue, critical care to paramedic as well. Parrishville, I've gone and done the ALS inspection and they are complete. Tri-Town is currently working on getting the equipment and will schedule an inspection when they have the equipment. Norfolk Rescue also notified us that they no longer had any paramedics on their roster, and they are now at the critical care level. All these changes have been sent to the operations email at the DOH. So there's the notification of all public access defibrillation applications that we've received since the last meeting. Different locations within Jefferson County for the YMCA, along with one in Lewis County at the Beaver River Memorial Post. Okay. So from the CC to paramedic bridge program, we have 9 new paramedics. Congratulations to all. 6 are in St. Lawrence County. We have 1 that's left to test. 2 are in Jefferson County, and then there was another bridge program out of out of the Mid-State area that gave us another new paramedic in Lewis County. So throughout the COVID process, all providers and instructors received a 1-year extension on their cards. They also went back and providers who had expired since a certain date, they were able, after review, to get their card back, and we brought 14 new providers back into the system that were expired. All of those cards will expire the end of this year, but they are eligible to renew via the CME program if they're in an agency and meet the other New York State requirements surrounding that program. Our office, with the assistance of a couple folks at FDR-HPO, we were able to electronically send every provider who is registered in our region a copy of their health commerce system printout that showed their new extension or their new expiration date on it. So we'd like to thank the folks at FDR-HPO for that help as well. With that said, all agencies should be registered in the health commerce system. We registered quite a few of them, and there's still some more that we need to get on board. I believe the future will hold a lot of paperwork going back and forth electronically through the HCS system. So, and HCS stands for Health Commerce System. Okay. So West Leiden Ambulance was approved for BLS albuterol. They notified us they were going to be doing syringe epinephrine, and they were approved for BLS CPAP, and the appropriate paperwork has been sent to the state as well as a follow-up to the ambulance service following the Remac meeting. So we're still currently working with Seaway Valley to get up and running with Image Trend. Beaver Falls, we had them just about there pre-COVID. We were actually scheduled to do a training, which unfortunately got canceled due to COVID. And the end of this month, I will be going to Lewis County. I will be following all the educational recommendations for social distancing and doing a training with them on Image Trend so we can get them up and running again, get them up and running electronically. And the Town of Brownville Joint Fire District started with ESO. So if you remember, the Remac a few years ago made a motion to move all transport agencies and ALSFRs by April of 2021 to electronic documentation platforms, and there are our remaining agencies that we have left. And I know that many of them are currently working on it right now. So we're almost there, having all our transport and ALSFR agencies electronic. I know that there's an initiative with the state. They are working diligently on coming up with a form that can be used by our BLSFR entities, so they will be able to go electronic and meet the requirements for the New York State CME program as well. Next one. So despite COVID, we moved forward with getting all our hospitals trained and up and running on Hospital Hub so that they can go in and get PCRs in Hospital Hub, which is part of the Coverdale Stroke Program. And we had them trained. We still went live April 1st. This enables our EMS agencies not to have to fax PCR. So one of the benefits is a more secure transmission of PCR data, and plus, irregardless of the PCR vendor, when it goes through our regional bridge and then into Hospital Hub, it all comes out in one format. So that makes it helpful for them when they are reviewing patient care. Next. So Cranberry Lake had some PCR, their paper PCRs had not been sent in to us. We have contacted them and they will be sending them in. Next. So normally our ALS CMEs would have been due June 30th. They were waived due to COVID for the first semester. So as it stands right now, but depending on what the rest of the year holds, ALS providers will only need to complete second semester skills and half of their didactic required annual hours. For December 31st, the BLS skills are still due at the end of the year. Again, that is dynamic pending on how things go. So stay tuned for more. Next. So EM resource, we've talked about it multiple times. COVID brought to light the need to really use this to understand what resources we had available in the community in the face of a pandemic. And Jonathan, do you want to talk a little more about that?
Sure. So we have regular usage in the system from Samaritan, River Hospital, Governor Hospital, Carthage Area Hospital, Lewis County General, Clifton Fine, Claxton Hepburn. Jefferson County Public Health is now starting to utilize it. Thanks to Paul and Chris at Jefferson County EMS, really pushing for them to use it. And also in light of COVID, Fort Drum, MedAC, MedOps, and Emergency Management have now started utilizing the system as a means of being able to track community resources, but also to see how they can best allocate their resources on post, off post to the community hospitals, because we all know with Fort Drum being a unique military base that does not have its own facility, they use our off post hospitals. Moving forward, Tom Zecker and I have been doing a lot of work with this project. We're going to work on bridging the gap to get into our dispatch centers. We're also going to continue to bring on additional EMS agencies. We do have some that are utilizing the system. And Tom and I are going to do a few more webinars to get them up and going. And we're going to continue to work with St. Lawrence Health Systems to get their remaining hospitals online in the system. But COVID really drove this project a lot faster than I think we were anticipating. Tom, am I missing anything?
No, I don't think so. I think you've covered everything. You know, I still think that you know, we're heading in the right direction. We've got a lot of positive motion. You know, now that COVID is slowing down, at least in our area, I still hope that the same efforts are going forth to continue progress. This project I still think is important. And other than, you know, as we continue to be successful, we'll be looking to, you know, potentially add in additional resources, such as seeing the upstate status for availability, as well as potentially other counties, depending on cost and strategic planning.
All right, so we do the opioid overdose program that helps supply first responders with Narcan. And we threw these stats out there because, as you can see, in the second quarter of 2020, there's been an alarming increase in the amount of Narcan that's been administered. And again, this does not include data from our ambulance services. So this is from our law enforcement partners, as well as our BLSFRs who obtain Narcan through our program. Now, one of the big things that they noted, as you can see, there were 35 interactions, yet 75 doses were administered. In many cases, it is taking multiple doses of Narcan for these patients to restore effective respirations. So we just kind of wanted to give you that data. We've been, you know, working with the folks at Public Health. They're aware of this as well. And I know that Paul and Chris at Jefferson County EMS do a lot with the OD mapping as well. I'm currently working with St. Lawrence County and trying to get their OD mapping kind of moving along and up and running, because there's been some different changes in the operations. And I know that Bob McKenzie has been tracking it in Lewis County, and they may have more information on that in their reports. All right, moving on. So just some miscellaneous stuff. What have we been doing during this whole time? Well, again, we've been working diligently trying to get everybody signed up into the health commerce system. So if you are with an agency who is not signed up on the health commerce system through our office, please have somebody contact me. I will be sending out another notice to those agencies that are not signed up. We've been working diligently up until the last week and a half, where other things have pulled me away from being able to do this, but we've been working on the National Ambulance contract, doing data entry, and that would be the hundreds of ambulances that responded to New York City and helped out during the crisis. So we still have an awful lot of data to enter, I do believe. So again, there's been program agency, course sponsor, and agency calls weekly during the peak of the COVID. They're now down to every other week. We were also sending weekly COVID activity reports to the state. I will say that I had a lot of contact and communication with my 3 county coordinator and emergency management offices. So thank you guys for all the hard work that you did during this, and to the agencies for all they did during this pandemic. We've done the St. Lawrence County EMS advisory meeting virtually. We were actually able to attend a Lewis County EMS advisory meeting. Jonathan or I have tried to be on the Jefferson County EMS calls that they were having. They were weekly, and then they're down to every other week or so now. We sent multiple correspondence between the agencies and the state with the new policies coming out, trying to keep everybody in the loop. We've been working diligently, learning Grants Gateway and working on contract extensions and budgets. And again, in our own office processes, through having to send all those emails out to our providers that are registered in the system, we also created an electronic file within our system. And we're currently working to have all the paper files scanned in electronically so that all our provider files will now be electronic. I do have a message here from Steve regarding the health commerce system, saying that they are going to want to get signed up soon on the health commerce system. And so make sure you give me a contact. I had 3 folks that I hadn't gotten back with. I tried to call back the other day that had initially contacted me and left them messages. So, all right. Any questions for the program agency or Remac? Okay, hearing none. Back to you, Deb.
Thank you, Ann. Larry Gerard, safety. I know Larry's on. Anything for safety, Larry? I'm going to take that as a no at this point. Mark, REMSCo and CMAC, please.
We have not had a REMSCo or CMAC meeting since the last Remac and REMSCO. There is one CON action that's at the REMSCO level that involves a service in the New York City area. The public hearing on it was last week, and we are waiting on a date for a REMSCO meeting that I would assume at this point is going to be virtual.
Very good. Training and education, Paul Barter.
From the overall standpoint with the COVID, pretty much our classes that we had set up in both St. Lawrence and Jefferson County for PHTLS, as well as our difficult airway venture, have all come to a hold at this point. as soon as we hear from a university that they're ready to go, I'm sure we can get those things rescheduled. But until they lift some of the restrictions, it's difficult with those class sessions to have the groups together. So other than that, I have nothing else from training and ed.
Paul, why don't you go right into the Jefferson County report, please?
Okay. Well, we have a little bit more for the county anyways. First and foremost, we did complete 3 of our classes, despite all the hurdles. I want to, at least at this point, thank the folks in Albany. I know there's some online anyways, but without their work down there and Albany working with the in their groups to allow us to do some of our virtual, and really gave us a lot of flexibility to accomplish completing these courses. And to that end, we were successfully able to complete all of our courses, including the one high school course that I want to give a shout out to Debbie, because she went from, you know, having students for 40 minutes 3 times a week to all of a sudden trying to revamp her entire schedule and doing things online and working out labs with groups of 4, spreading them out. You know, there's a lot of work for those that were not physically teaching. That was a lot of work. And our other courses as well, they did just a super job, and I want to thank them publicly. Moving forward, we have a full slate of courses scheduled for August. We're going to be putting on, hopefully at this point, another class at the South Jefferson High School, one at Public Health and one at Lewis County Search and Rescue for BLS. We have a BLS refresher scheduled here at Public Health, and one in Clayton at Tears Rescue. And we will be doing a paramedic refresher down at Adams at South Jefferson. All of these classes are starting in August. We will be doing others, considerations to do an advanced class and CFRs in the spring. But for right now, those are our fall courses. We've done a lot of changes to our Heart Association affiliation. We are currently doing updates, though there are no official 2020 updates from the Heart Association. We have done our own updates, and we are holding a BLS instructor course September 12th with a limited number of students to accommodate the COVID requirements. Following that, we will be putting on both ACLS and PALS instructor courses with follow-up provider courses as well. We have interest out there, and we are anticipating doing a CLI in the fall. At this point, it's just a work in progress. We need to coordinate with the state and put our application in and so on. The Herkimer program was very much a success, and I want to do a shout out to the folks at Guilfoyle at the Bruce Wright Memorial Center. They put in a fantastic sound system over there, so the students in the North Country could go to Watertown instead of having to commute to Utica. So that worked very well. Ann's already talked about the bridge folks. Kudos. She had failed to mention herself and Debbie as 2 of those newer paramedics, so congratulations, you guys. We are, as Ann had mentioned, we are working very closely with the OD mapping and doing a lot of overdose trackings. We're also in the process of working with the Credo Foundation with a program to actually will be similar to the Leave Behind program. for providers to leave a kit with inside that kit there are information on where to obtain help, utilizing all the different agencies in the immediate area. So we still continue to work with the COVID monitoring and tracking. It has its ups and downs, but overall we've done extremely well in the county. And other than that, if anybody has any specific questions, I'd be happy to entertain them.
So our class will be a go at South Jeff again this fall. I had 21 kids in the first EMT class, and I had 15 signed up for this class. It'll begin when the school year starts. We're having a meeting with the children and their parents in August at the school in the auditorium where we can practice social distancing to go over the requirements for the program. It was concerned whether it was going to be a go or not, because if the budget had not passed, they would not be able to do it. But the South Jeff school budget passed, so we're able to continue on with that program. Does anybody have any questions for Paul for Jefferson County? Jonathan Mitchell, St. Lawrence County.
Hello, yeah, so we're just continuing with our mutual aid document and planning, our county mutual aid document. We're just figuring out how to implement our newly created maps into our CAD system. We have to parse them out and add them into our polygons into our Esri system. We've also launched a new county website, which also incorporates our Bureau of EMS website for the county. So that's also been updated. It has training listings on there, and we're working closely with SUNY Canton, which is our course sponsor, to figure out what exactly to put up there and when their next course is going to be. Other than that, we're just working diligently with COVID. I don't really have anything else for St. Lawrence County unless anybody has any questions.
Art Garno, do you have anything to add from the Canton end?
Just that we are just getting the approval to start programs back up starting the 15th of this month, just in a couple days. So we'll be looking at what we can do to finish the students that were in the spring class that couldn't do their practical skills, and then looking at a possible date and an instructor for the fall. So we will be getting dates out to these guys to post as soon as we can get them together.
Very good, thank you. Bob McKenzie, Lewis County.
Good evening. I hope you can hear me all right. And those of you who can see me, welcome to my backyard. We did in fact pick up the OD mapping in Lewis County in the office. Prior to that, it was being done by Lowville PD. They were doing a fairly good job, but one thing that we discovered is that the state police run on a different type of mapping program, and a lot of that data wasn't being captured. So we're attempting to work on that. As far as the multiple number of doses, one of the things that we recognize is that the patrols weren't maybe willing to use a pocket mask with an overdose. So we went ahead and provided all of our patrols with bag valve masks. So now they're carrying them in their vehicles, and they are actually being deployed in the field for overdoses as well. At this time, as far as EMS in the county, we did have we did actually have a meeting, in-person meeting, utilizing all social distancing rules, and that went exceptionally well. A lot of our time in the office has been dedicated to this COVID-19 response. But a lot of the response that we had from the office, a lot of that burden was taken off of us by a group of people a few years back who were members of what we had a pandemic flu committee, and Mark Tuttle being one of them. They worked with public health, and they actually had a cache of N95s and surgical masks and hand sanitizers and various other types of things. And when we we're able to tap into that because we have kept it up over the years, and we've kept the masks within date. And we do have a few that are out of date. I will readily admit that, but we were able to keep them within date. If it wasn't for the legwork that they did for us back in 2009, we would be in a very, very different position right now. Our response within our county was able to be such that none of our agencies ever went without. Any emergency manager throughout the county had to put in requests through a system called New York Responds, and it was a be all and end all for everybody. I'm going to tell you from my standpoint, the New York Response system imploded. If you did not have your own items within your own county or access to your own items within your county, they came to you, but they were very, very limited in the numbers that you were receiving. So it was, although it did function to some degree, it did not work the way it was supposed to work. Supplies were locked in under the Defense Act, and a lot of the requests were put on hold, and they were put on permanent hold. And I actually have a couple of open tickets right to this point. But through that pandemic flu committee, we were able to respond within our county and be able to equip folks within our county with everything that they needed, and nobody wanted for anything. So if anybody is interested, I would definitely be willing to share that plan. Although it is a little dated, I'm in the process of updating it right now. I'm going to be reaching out to Mark to be able to work with him a little bit to kind of get that more into a pandemic mode such as what we saw. So with that said, COVID-19 is where our office has been at, and hopefully we can get through this thing, and hopefully we don't have round two. I would brace yourself for round two, though. That's pretty much the way it looks at this point. Any questions, please feel free to reach out to the office. If you're interested in the plan, please feel free to reach out. That's the end of my report.
Thank you, Bob. Any questions for Bob for Lewis County? Okay, we will go on to old business. I think I may have inadvertently not taken these off. I believe we already did the
I
CMAC.
think Ryan had a question, Debbie. I saw his mouth moving.
Oh.
But I think he's trying to get unmuted.
We're not hearing anything. We'll keep moving, Ryan. We'll keep moving. Hopefully you can fix that, because I was going to give you state folks a chance to give any information you wanted to the council as well. So maybe we'll have that fixed by then. Bob, correct me if I'm wrong, but I believe we approved your Lewis County mutual aid agreement at our February meeting.
That is correct. Thank you very much for that.
You're welcome. I just submitted taking these off. An update on the difficult airway. Obviously, with COVID hitting, we weren't able to do our classes. We're going to look at maybe doing some virtual online training and then bringing people in small groups to do the skills and having them monitor it from where they're located at Stony Brook, and that would allow us to continue and get that contract renewed. Spring Fling. Obviously, we didn't hold it in April, so we're looking at a fall type event. If we can do it, it would be in October. I've been in contact with Edgewood and Janine, and she recognizes that it's really on the state's end to say how many people can gather and things like that. We did have a conversation earlier today, Mark Devers, Ann Smith, and myself, about seeing if we aren't able to hold it in person, maybe doing something different, but there'll be more to come on that. Does anybody else have any old business before we go to new business? Hearing none, we'll keep moving into new business. First, I want to give an update on the Remac appointments. As you know, we appoint people to a 2-year term. We have half of them expire 1 year, even years, and the other half odd. With what's gone on, we have decided to extend everybody's appointment by a year. So those that were expiring in 20 will now be 21, and the 21 folks will be 22. We just haven't had the meetings, and we haven't been able to, post any openings with everything going on. So we felt the best thing to do would be to extend them by a year each. Our insurance for our directors and officers insurance is up for renewal. It actually was up last month, but the company allowed us to wait until we had a meeting because of COVID, and that fee is $888. When we get down to motions, I'm going to be looking for somebody to, well, I guess I would take a motion from the floor to continue with our directors and officers insurance in a second, and then we'll vote on it at the end.
I'll make that motion, Bob McKenzie.
Second
Karen
motion, Carol.
I'm sorry, who seconded?
Carol.
Carol.
So we have a motion from Bob McKenzie and a second from Carol Mooch to continue with our directors and officers insurance at a rate of $888. And again, we'll vote on that at the end. Does anybody else have any new business? Once we're done with that, we're going to ask, we've got Ryan Greenberg, the director for EMS for the state on, Steve DeZurio, deputy director, and Mike Bogosi and John Morrissey that everybody's familiar with from the central region they were on as well. We'll give them an opportunity to speak. Does anybody else have any new business? Okay, Ryan, were you able to unmute?
I think so. Does it work now?
It does.
All right, awesome. Well, Bob, if you could send me a copy of that plan, I'd like to see it. So I will definitely not take up too much of anybody's time. I'm happy to answer any questions, but with John, Mike, and Steve being here, I really want to, allow them that opportunity. For starters, I want to say thank you to everybody. The past couple of months has been an unprecedented time, and so on behalf of the Bureau and all the challenges and hurdles that you had to go through, please, I would like to say thank you to you, and please express that to your membership and to all your responders who've been out there. Regardless of how busy of a system you're in or not, getting out there during these challenging times and just with so many unknowns is flat out scary sometimes. And so it's, to keep things operational and doing everything you're doing has been just amazing. Myself and Steve have, the bonus of one of the things of COVID is things going on to more Skype and WebExes and things like that. It's both a pro and a con, but one of the bonuses is, having the opportunity to participate in more meetings like this. So we are trying to get out there more and see just kind of what's going on and answer any questions that you have on the state level. It's also super important for us to hear the feedback too of what you're looking for. Particularly right now, we're in the middle of some after action reports from round one. And unfortunately, similar to what Bob said, we do think there will be a round two. We hope not, but we're asking everybody to plan for it now. And realistically, if, round two is to happen, we're probably less than 90 days away from that occurring. And so we really have done a big push to agencies on our biweekly calls now that you start looking and saying, okay, well, what worked, what didn't work, what do we have in place, what don't we have in place? And, one of those things that we're working on in the state and actually working with Chief Bogosi on this one is, what are some things that we can provide as a metrics to allow regions and agencies to adapt as if there is a round two evolves. One of the things we learned from, round one was every part of the state isn't the same. And, some places were hit harder than others. Some places, really didn't feel the effect too much at all. And so we want to give a tool set that allows you some flexibility to prepare for that and maybe not go below a certain standard, but at the same time to increase the standard depending on what's going on in the given region. One of the big things that, we hear on a not current, but, one of the things we hear is how much PPE should we have on hand? what's our response models and what should it be? There's no perfect answer to anything, and we're working on that guidance documents now to be able to put that out there. The hospitals are required to have 90 days on hand. We understand for some EMS agencies that may or may not be an option, whether that be because of supply chain, finances, or fill in the blank. But we're working on some best practices to put that together for you. And so we're hoping that, probably early August, you'll see that guidance document coming out, hopefully. So there's a education policy that is in the approval process right now, and that one we're hoping will come out in the near future, hopefully in the month of July, and that will go into some different standards and different things of things that we're allowing during everything that's going on right now, and some accommodations and things related to education, related to CME program, related to testing. So these are all things that are moving forward on that front. Many people said, well, aren't you happy? It's kind of slowed down a little bit now. At the Department of Health, it is not slowed down very much. It is a new series of things. It's and some new challenges that we're working on, including staffing airports to make sure that everybody coming in from states that are, required to have a little bit extra precautions as they come back in, we're participating in that as well. But, our primary focus and commitment is to the REMSCOs and to our agencies and our providers to get them what they need. And we're trying to take advantage of this time in between to get there. So I just want to say thank you again. That's a very short clip of what's going on with us. And I'm happy to take any questions. And if no questions, I'm happy to pass it off to Steve and Mike and let them give some insight.
Any questions for Ryan? Steve.
Awesome.
I believe John is going to go over and do the update for the region. John, are you on? All right, can you guys hear me?
We can.
Yes. Okay, thank you. All right, well, I think Mr. Morrissey's having some issues getting on. Are you there, John?
Did I meet the time or they closed?
I work here.
Hello, my bad.
John, it looks like you're unmuted now. Do you want to give a report, please?
All right, well, I'll just go over a couple things that we had on our list. One, John and I are still working from home, and Kathy, we're all still working from home. I am going into the office about once a week just to grab mail, get anything processed that needs to go right out. We're still doing the leadership and the other calls every other week now. And John, Kathy, and I have been working on new policy statements related to COVID activities. And then the last thing was just if your agency is moving physical location, please let us know. But if your agency carries controlled substances, we also have to notify D&E. So that would be just changing your 3826 and 3827 and resubmitting those with the new address on. Other than that, that's all I have to add. If you guys have any questions, I'm available.
Any questions for Michael? Steve DeZerio, did you have anything you wanted to add?
Can you hear me now?
We can.
Okay. I was talking before, but apparently I am still learning technology. So speaking of technology, a lot of our focus is, learning how to navigate the new world. So I commend your whole region for getting your folks onto HCS, specifically to Ann and team for emailing out all those cards. That's pretty awesome, and I'm not aware of another region that's done that. We are working on developing more functionality for the HCS system. The next group that'll go on that system will be providers at some point over the summer. We're working with our tech folks now. That'll allow us to do more in there, including have EMTs be able to go in and check their own certification, not others, but their own, and help us with some tracking of agency information and updates, so that we're taking that the paper process out of that. As Mike said, we're still not in the office anywhere. We're all remote, so bear with us on any paper-based processes. It takes a few extra days to get things scanned in and pushed off to the right staff member. But again, thank you for everything you guys did during COVID, and your communication that you kept putting out. You're both through the region, your program agency, keeping in touch with us and aware of what was going on in your region. I heard some discussion about PPE, and I would highly recommend that agencies stock up on PPE whenever and wherever they can. Purchase, obviously through legitimate vendors, but make sure you're stocking up on N95s, gowns, masks, so on, because the rest of the world is still in COVID crisis, and although we've calmed down for a bit, supplies are still going to be scarce. So that's about all I got, and I appreciate you guys inviting us onto these calls. It's interesting, enlightening, and happy to hear what's going on in the region. Thank you.
Thank you very much. Is there any other new business before we go through and we have to do a roll call vote on all the motions that we had prior during the meeting? Hearing none, Dave Sherman, I will read the motion and then you will do the roll call vote. Review of previous minutes. We had a motion and a second to approve those. Roll call vote for that, please.
James Barr.
Aye.
Paul Barter.
Yes.
Mike Bennett.
Aye.
Karen Blackburn.
Yes.
Mark Dalton.
Yes.
Mark Devers.
Yes.
Ken Gardner.
Yes.
Art Garrow.
Yes.
Larry Gerard. Jay Gannett. Ron Hantz.
Yes.
Rich Hughes.
Yes.
Melissa Chansey.
Yes.
Kristen Johnson.
Yes.
Walt Lehman.
Yes.
Josh Levesque.
Yes.
Bob McKenzie.
Yes.
John Mitchell.
Yes.
Carol Munch.
Yes.
Lance Ronas.
Yes.
Dave Sherman, yes. Bobby Simpson. Debbie Singleton.
Yes.
Ron Smith.
Yes.
Dottie Suter. Mark Tuttle,
Yes.
Bruce Wright, Matt Yelton,
Yes.
$23 yes, no against. Passes.
Thank you. Treasurer's report. The report was given by Jonathan in Jay's absence. You provided what our current balances are. Do we have a motion to accept the treasurer's report as presented?
Lance Ronis moves.
Lance makes a motion. Second.
I'll second it, Dave Sherman.
I'll second it.
Okay. All those in favor, go ahead, Dave.
James Barr,
Yes.
Paul Barter,
Yes.
Mike Bennett,
Yes.
Karen Blackburn,
Yes.
Mark Dalton,
Yes.
Mark Devers,
Yes.
Ken Gardner,
Yes.
Art Garno,
Yes.
Jay Gannett. Oops, not here. Ron Hantz,
Yes.
Rich Hughes,
Yes.
Melissa Jancy,
Yes.
Kristen Johnson,
Yes.
Walt Lehman, Walt.
Yes.
Okay. Josh Levesque,
Yes.
Bob McKenzie,
Yes.
Jonathan Mitchell,
Yes.
Carol Munch,
Yes.
Lance Ronis,
Yes.
Dave Sherman, yes. Debbie Singleton,
Yes.
Ron Smith,
Yes.
Mark Tuttle,
Yes.
and Matt Yelton.
Yes.
That passes.
Thank you. Next is the election of officers. We have Mark Devers, who's been brought forth from the nominating committee to remain vice chair. Are there any other nominations from the floor? Are there any other nominations from the floor? Are there any other nominations from the floor? Hearing none, I would like somebody to make a motion to have the secretary cast one ballot for Mark Devers to remain as vice chair.
I'll make that motion.
Motion made by Ron Smith to have Mark Devers remain vice chair. Do I have a second?
Seconded, Mark Tuttle.
Mark Tuttle seconds. We'll have the secretary cast one ballot for Mark Devers to remain vice chair. The next is treasurer. Jay Gannett has been brought forth by the nominating committee to remain as treasurer. Are there any other nominations from the floor? Are there any other nominations from the floor? Are there any other nominations from the floor?
I'll move that we close the nominations and the secretary cast one ballot.
Ron Smith makes a motion that we close the nominations and that the secretary cast one ballot for Jay Gannett for treasurer. Do I have a second, please?
Lance Ronis second.
Seconded by Lance Romanis. Thank you. Moving on, the next item to be voted on is the renewal directors and officers insurance at a cost, excuse me, at a cost of $888. That's already had a motion in a second. Dave, if you would do the roll call vote.
James Barr,
Yes.
Paul Barter,
Yes.
Mike Bennett,
Aye.
Karen Blackburn,
Yes.
Mark Dalton,
Yes.
Mark Devers,
Yes.
Ken Gardner,
Yes.
Art Garno,
Yes.
Larry Gerard, let's go. Jake Bennett, Ron Hantz,
Yes.
Rich Hughes,
Yes.
Melissa Jancy,
Yes.
Kristen Johnson,
Yes.
Walt Lehman,
Yes.
Josh Levesque,
Yes.
Robert McKenzie,
Yes.
Jonathan Mitchell,
Yes.
Carol Munch,
Yes.
Lance Ronas,
Yes.
Dave Sherman, yes. Debbie Singleton,
Yes.
Ron Smith,
Yes.
Mark Tuttle,
Yes.
and Matthew Yelton.
Yes.
And that passes without any opposition.
Very good. Thank you. I appreciate everybody's efforts in calling in. I know this is a difficult way to sometimes do a meeting, but I think everybody's done a great job and we were able to efficiently get through stuff, and you could do it from your home. And I'm envious. I see Karen sitting outside, and I know that Bob McKenzie was outside, and it's nice to be able to do that. So I truly appreciate you calling in. Ann, do you have anything to add?
Yeah, just real quick, again, as Debbie said, this is new to all of us, so we would really, really appreciate if you could email us any feedback that you have, good, bad, or indifferent, or any recommendations for ways that we could facilitate this or make this go better. Just because I have a feeling that we may be doing this again for a few times. So any feedback greatly appreciated, so we can continually improve the process. Thank you, everyone, and stay safe. It's good here in St. Lawrence County, but I'm hearing that there's some storms rolling through Jefferson County, or at least in my part of St. Lawrence.
So I would like to thank Ann Smith and Jonathan. It hasn't been easy working from home. You know, they find they need stuff in the office, and the big joke with Jonathan is he would come into town to the fish market once a week so we could hook up if we needed to sign things. Truly appreciate your efforts in helping us. Paul Barter, Jonathan Mitchell, Bob McKenzie, thank you for helping keep our providers safe and give them the information they need. We all need to work on this together, and I think that, you know, it's just another hurdle that's been thrown at us, but we're stronger as a team, and I know we can get through this. Hearing nothing else, I will go ahead and close this meeting. And again, thank you. Watch for communication. If we don't have any other CONs come in, we won't meet again until October. But if they do come in, we will need to meet earlier than that.
Perfect.
Thank you, everybody.
Thank you.
Thanks, Deb.
Thank you.
And